Hi everyone, so I'll be sharing videos which will be helpful for those appearing for emerged TCAM examinations. So first, I'll be sharing the important points and previous questions and all we can discuss. So start with pediatrics, newborns from delivery to 28 days, infants 28 to 1 year, toddler 1 to 3 years and preschool 3 to 5 years. 2.5 to 4 is a normal birth weight. More than 4 we call it macrosomia and less than 2.5 it is called low birth weight. Group also known as laryngotracheobronchitis. It is an upper respiratory tract infection seen in infants and toddlers. It is caused by parainfluenza virus. This is a common question. Clinical features include stridor, barking cough, aggravated at night, fever, coryza. And on X-ray, the steeple sign can be seen. I'll share the picture. In severe group, frequent barking cough, prominent inspiratory stridor, marked sternal wall retraction and all can be seen. Lethargy, restlessness, tachycardia and all will be there. Management is mainly by steroids, oral dexamethasone, prednisolone, etc. And in emergency, high flow oxygen, nebulized adrenaline, etc. can be given. Epiglottitis, it is caused by Haemophilus influenza B virus. This is commonly asked. Clinical features include rapid onset fever, stridor, drooling saliva, muffled speech, also known as hot potato speech, difficulty in speaking, changes in voice. On X-ray, thumb sign can be seen indicating enlarged epiglottitis. It is an emergency and you should call an anesthesiologist and intubate. Differentiating feature between group and epiglottitis mainly barking cough. This is a common question. Bronchiolitis is seen in children less than 1 year. It is caused by respiratory syncytial virus. This is also a commonly asked question. Clinical features wheezing, shortness of breath, cough, low-grade fever and all. For this treatment, no steroids or antibiotics, supportive care is given. Now, infant respiratory distress syndrome, seen in preterm babies due to deficient surfactant. The surfactants helps to prevent the collapse of the lung alveoli. Risk factors include preterm, C-section, maternal diabetes, etc. And on chest X-ray, diffuse ground glass appearance can be seen. It affects approximately 1/2 of infants born at 28 to 32 weeks of gestation. It's rare after 32 weeks. Clinical features include tachypnea, expiratory grunting, subcostal and intercostal retractions, diminished breath sound, cyanosis, nasal flaring, etc. And treatment includes continuous positive air pressure. Now, asthma is mainly bronchoconstriction. There will be a family history and other triggering factors, allergens such as pollen grains, cold dust, etc. And treatment is by bronchodilators. In life-threatening asthma, silent chest, no breath sound or auscultation, cyanosis, hypotension, confusion, drowsiness can be seen. Treatment is to intubate. Acute severe asthma, saturation will be less than 92. Heart rate will be greater than 125. Cannot complete a sentence in one breath. Management, oxygen, salbutamol nebulization. If no relief, prednisolone, infratopium, bromide can be given. Now, viral rashes. This topic is very important. So, let's start with measles. For measles, fever, maculopapular, erythematous rashes, cough, conjunctivitis and all can be seen. Rash mainly appears on the 4th day. And when the rash appears, the fever shoots. This is a very important point actually. Coplic spots, that is whitish grey spots, can be seen on the buccal mucosa, mainly near the second lower molar tooth. It is caused by RNA virus and incubation period 10 days. Cervical lymphadenopathy can be seen, and the most common complication of measles is otitis media, and neurological complication is subacute sclerosing panencephalitis. It usually appears 3 to 8 years after the measles. In adults, orchitis can be seen as a complication. Rubella is also known as German measles. Fossema spot can be seen on the soft palate. It starts as red or pink spots or rashes behind the ears and spread to the rest of the body. Swollen lymph nodes and all can be seen. Now, roseola is caused by human papillomavirus 6. It is known as 6 disease. In roseola, as the rash appears, fever subsides. In measles, we said as the rash appears on the 4th day, the fever shoots. But in roseola, as the rash appears, fever subsides. Next is erythema infectiosum. It is also known as 5th disease caused by parvovirus B19. Low-grade fever, slap cheek appearance can be seen. Means not present on the nasolabial fold. It is a self-limiting disease. supportive care can be given. Now, rash on the first day, chickenpox. Rash on the second day can be seen in scarlet fever. Rash on the fourth day can be seen in measles. Parvovirus B19 can also cause pure red cell aplasia, acute persistent arthropathy in children, papular purpuric eruptions on the hands and feet, glove and sock syndrome in adults. Parvovirus B19 is also known to cause hybrid fetalis.